And now I would like to introduce our first panelist. Stephen H. Woolf, MD, MPH, is a leading researcher on child mortality, a senior fellow at American Progress, and a professor of family medicine and population health at Virginia Commonwealth University School of Medicine, where he is the founding director of the Center on Society and Health, and now holds the C. Kenneth and Diane Wright Distinguished Chair in Population Health and Health Equity. He is a leading expert on child injury mortality and the lead author of a recent JAMA Viewpoint, The New Crisis of Increasing All-Cause Mortality in U.S. Children and Adolescents. Dr. Wolf's career has focused on raising public awareness about social, economic, and environmental conditions that shape health and produce inequities. He will discuss the latest data on child mortality and ways to address the issue in the United States. Welcome, Dr. Wolf.
Thank you, Cherie. It's my pleasure to be here, and good afternoon, everyone. Good morning if you're joining us further west. I'm just going to take a few minutes to talk with you about an alarming trend that we are seeing in death rates in America's children and teenagers. It's not a cheerful topic, but I think it really raises the alarm about the trend that the country is currently experiencing. Let me back up just to put this in context a little bit. We have a long-standing problem in the United States regarding our life expectancy. For some years, as you can see on this graph, the rate at which life expectancy has increased in the United States has been slower than in other industrialized countries. And then after 2010, our life expectancy basically flatlined and we stopped seeing increases altogether. And you might think this had something to do with the death rates affecting our children, but it actually did not. This trend in life expectancy was being driven by rising death rates in young and middle-aged adults, 25 to 64 years. And this has been an alarming trend that has been concerning public health experts for the past decade. But during all that time, the one bit of good news was that death rates on either end of the age extreme for young people and our elderly were going down. They were going in the right direction. That was all true up until the COVID-19 pandemic. Obviously, death rates in the elderly increased significantly during the pandemic because older adults were more vulnerable to the disease. But we thought that the trend in children would continue to decline. Unfortunately, the news is not good. And so let me give you some background. As I said, the original concern was in middle-aged adults. Then later on, the research evidence began to indicate that young adults were being affected. But in the pediatric population, and here you're seeing death rates for children ages 1 to 19, you can see that up until about 2014 or so, we were seeing steady progress of lowering mortality rates in males, shown here, and females here. As the pandemic was approaching, the years leading up to the pandemic, we saw a concerning trend where that decline seemed to be flatlining. But it was during the recent 2 years, during the COVID-19 pandemic, when we saw a sudden and unprecedented increase in all-cause mortality rates. When I say all-cause mortality rates, I mean deaths from everything. And basically what we saw during the years 2020 and 21 was a 20% increase in all-cause mortality. As I'll show you later, this degree of increase has not occurred for at least a half a century and possibly since the Spanish flu pandemic. What's responsible for that increase? You might think it's COVID-19, but it actually was not. COVID-19 played a marginal role in this increase. What actually was driving it was an increase in deaths from injuries. And you can see that on this graph. What the graph is showing you in the blue lines are death rates in young males and male youth. The solid line are deaths from injuries. The dashed blue line are deaths from non-injuries, which basically refers to medical conditions. The red line is for females, the solid red line showing injuries for females, the dashed red line, non-injuries for females. And so several things jump out at you at this slide. First off, obviously, is the high injury rate among males. What you can also see, though, is that in general, up until the pandemic, the injury death rates were decreasing. but then they underwent a significant increase during the years of the pandemic. Now, one might think that this was something that had to do with COVID-19. As I mentioned, it played a relatively small role. In fact, the absolute increase in injury mortality that we saw during 20 and 21 was 12 times higher than the death rate from COVID. And it was basically the four causes shown on this slide that were driving that: suicide, homicide, accidental drug overdoses, and motor vehicle crashes. Those four causes were mainly responsible for this reversal in all-cause mortality. And as I'll talk about in a few minutes, this is a very tragic turn of events because it basically means that these four causes are outweighing all the lives that have been saved by advances in pediatric medicine and injury prevention. We saw in looking at this data, however, that this was not initiated by the COVID-19 pandemic. In all but the last case, suicide, homicide, and drug overdoses, the problem began before the COVID-19 pandemic. It's just that the pandemic exacerbated it. So let's take a look at the data. Suicide rates. This is in the age group 10 to 19. And I've broken it down by race, ethnicity for an important reason that the following speakers will elaborate on, which is that the exposure to these risks is not even across our youth. That a youth of color very often have disproportionate exposure to these risks, but not always so. So here what you can see with suicide is, first of all, that this has been on the rise for many years. In fact, suicide rates among our youth in America have been increasing since 2007, so more than 15 years of increasing suicide rates. You can also see that it's the white population that has experienced the highest suicide rate, at least seemingly so, but there's an important group not shown on this slide, and that's Native American youth. If we add them to the slide, it looks like this. It basically suppresses all the other curves because the suicide rate is so high among American Indian and Alaska Native youth. You'll see, though, that the line is rather erratic for this population, and that statistical noise is created by the fact that the number of American Indian youth is smaller in terms of population size than other groups in the United States. So our mortality rate estimates are a little bit more variable. I've added a trend line to give you a sense of it, but it's partly because of this reason that I will not always be showing data for the Native American youth. But it's important to emphasize that with all that statistical noise set aside, you can clearly see that their suicide rates are horrifically higher compared to other youth. Homicide rates, those have been on the increase since 2013 in the United States. Here you can see that the homicide rate among Black youth is much higher than it is among white and Hispanic youth. And this is a pretty dramatic difference in death rates. Non-Hispanic Black youth accounted for about 63% of the homicides that occurred at ages 10 to 19. The rate that they experience homicides is 6 times that for Hispanic and more than 20 times that of a non-Hispanic white and Asian youth. If you disaggregate this by sex, knowing that males are more at risk than females, it turns out that Black males ages 10 to 19 are 61 times more likely to die in a homicide than white females of the same age. And we'll talk a little bit about what factors may be responsible for that. Firearms, we've talked about suicide and homicide. Firearms account for a huge proportion of these deaths. In fact, firearms accounted for about half of the increase in all-cause mortality that we saw during 20 and 2021. Taken together, this graph shows all of the deaths related to firearms broken out by race and ethnicity. And as you can see, Black youth experienced a larger proportion of these deaths, but you see also that, again, the American Indian and Alaska Native population experienced a very large number of deaths and increases during the years leading up to the pandemic. Now, the other factor that has entered onto the scene is drug overdose deaths. The opioid epidemic exposed white youth to increasing rates of deaths from drug overdoses for many years. So you can see on that red line on the graph, the fact that for the decade preceding the pandemic and more, white youth and adolescents in particular were experiencing drug overdose death rates at a considerably higher rate than Black and Hispanic youth. But as we've seen in the adult population, the opioid epidemic has hit people of color very hard in recent years. The increased access to fentanyl and other synthetic opioids has caused a marked increase in drug overdose death rates among people of color in the adult population. And now what we were seeing in the years just before the pandemic is that this trend was reaching down into teenagers, where we were starting to see an increase in drug overdose death rates among Hispanic and Black youth. And during the pandemic, you can see that basically caught up with the white death rate. And basically that rate is now statistically equivalent. The fourth category that I mentioned is car accidents. And for the most part, this has been a public health success story. Death rates, if you look on the left-hand side of the graph, have been plummeting from car accidents due to successes in preventing auto injury deaths using occupant restraints like car seats and seat belts, the airbags, other design features that have made cars and roads safer have produced a remarkable reduction in death rates. But during the COVID-19 pandemic, we saw a sharp increase in car accidents and fatal crash fatalities. Here you see the death rates among youth ages 10 to 19. And what's remarkable about this, again, much like the story with drug overdoses, is that for many years it was white youth who were most likely to die in car accidents. But in recent years, we've seen a surge in deaths from car accidents among Black and Hispanic youth and also Native American youth that has matched that and surpassed that of the white population. Again, the same curve, I'm adding in the data for Native American youth, and you can see that they are the racial group that has the highest likelihood of dying in car accidents of all categories of youth by race and ethnicity. So we say that the COVID-19 pandemic didn't start this. For 3 of those 4 causes, they began years earlier, but it poured fuel on the fire. It really exacerbated these trends. As you can see, injury mortality overall rose by 23% just in the year between 2019 and 2020. Homicide rates climbed by 39%, drug overdoses by 114%, car accident deaths by 16%. Even in younger children, we saw an increase in injury deaths, and 2/3 of that was caused by injuries. So I just want to pause for a minute and stop talking with all the jargon to explain in plain English what we mean when we say there's an increase in all-cause mortality. All-cause mortality, meaning deaths from all causes, is a bit of a tug of war between causes of death where we see progress in lowering mortality rates and other causes of death like the ones we've just been talking about that are causing an increase in all-cause mortality rates. In general, the first category has won out among our youth. That is, the progress that we have made in lowering death rates has produced a general trend of decreasing all-cause mortality. This is a graph that goes back to 1968. And you can see that the trend line has clearly been in the area of progress. But pay attention right here to what happened with the trend line. This is the way it's supposed to have kept going in recent years. But this increase that we've been talking about in today's talk means that something has risen to such a high rate of deaths, causing so many deaths among youth, that it is offsetting all the progress that has been made in other categories. And it's been a remarkable amount of progress. Progress in the prevention of disease through the introduction of antibiotics and vaccinations, progress in treating diseases that were the leading causes of death in children, like childhood leukemia, progress in preventing injuries from car accidents, fires, drowning, and so forth, and a massive amount of lives gained in young Americans because of this progress. However, what this recent increase in all-cause mortality means is that all of that progress at this point is now being offset by the massive death toll caused by those 4 causes. And so it really makes us focus on 3 areas that I think are really huge priorities. One that's obviously jumping off the screen as you watch these data is a mental health crisis in our youth. the fact that suicide rates have been increasing since 2007 is indication enough. But we already knew about increasing issues of stress, depression, and other mental health challenges facing our young people, which the pandemic only exacerbated. It's not only a problem that we have root causes responsible for their mental health issues, but also an inadequate degree of mental health services for young people to provide help. Our mental health system is inadequate in the United States. It's particularly inadequate for the pediatric population, especially those living in rural areas. The second major policy issue coming off this data is the role of guns. Firearms accounted for the vast majority of this increase in all-cause mortality. As mentioned earlier, it is now the leading cause of death in children. It passed car accidents and now is the most likely reason our young people are destined to die. And then ultimately, we have to confront the issue of inequity and marginalization. The disproportionate increase in homicide rates and other kinds of injury rates among certain racial and ethnic groups and in low-income communities across our country really has to do a lot with history and policies and structural factors that have exposed those neighborhoods and those populations to generations of marginalization that have cut off opportunities for social and economic mobility and better health, and that have resulted in tremendous stresses that manifest themselves in some cases through self-harm in terms of suicide and other kinds of self-damage, and violence that ultimately can lead easily to conflict. If you combine that kind of stress and conflict with easy access to guns and increasingly lethal guns, as is the case now, it's a toxic mixture leading to this dramatic increase in death rates. I want to make one final point before I pause for the following speakers to emphasize that we're hearing a lot in the news about mass shootings and the deaths of young people at schools due to some of these mass shooting incidents. And like any parent, I am horrified by the news of these mass shootings and seeing these scenes on our television screens. But as an epidemiologist, I must tell you that the death toll from guns that we're talking about is not coming from mass shootings primarily. It's coming from shootings that are occurring one at a time every day in communities across this country. You'll hear on your evening news about a shooting or multiple shootings that have occurred during the day in your community. Many of those involve our youth, and they're adding up to such a massive number that it's producing this shift in all-cause mortality that I'm telling you about. So with that, I'm going to pause and turn it over to my colleagues. Thank you for your attention.
Thank you so much, Dr. Woolf, for a very difficult, very important discussion and what we must do to address rising child mortality. Your discussion of inequities is a perfect transition to our next speaker.